Everything you're about to see, hear, and witness is under two course.
Can you describe your career path to date?
Yes, I'm what you call a wandering metabolic minstrel. In other words, I've worked in many fields. I started off in general practice, and then I went into chemical pathologist, trained as a chemical pathologist, and then I left the laboratory and went into private practice in relation to testosterone treatment. But I found that rather than the sort of circulatory problems that I was expecting, I had people with this condition called the male menopause come to me. And I got more and more interested in this, and really spent the last 25 years of my career working on testosterone and treatment and comparisons with the female menopause.
What are the symptoms of, first of all, the male menopause?
Well, they're very similar to the symptoms of what you'd expect of the female menopause. But the most prominent one, and the one that men most often complain of, is difficulty with erections, particularly loss of early morning erections. But they can get night sweats and even hot flushes, and also depression can be quite severe when the active testosterone level drops.
What are the how has the treatment developed over the last 10 years?
Testosterone treatment has come along quite fast, really, over the last 10 years, with new testosterone preparations, but still it's the same basic molecule. It doesn't come from Peruvian bull's testicles in the mating season, as it were, but it's actually derived from soy. It's closely related to soy, and they tweak the molecule and produce testosterone from it. So most preparations now are pure, what you call bioidentical testosterone, which is the real thing, the real McCoy.
Is there a typical testosterone deficiency sufferer?
Yes, the most typical is the man of around 50. In other words, he's going through the menopause at the same age as his wife, but it can vary in age. It's more variable than the female menopause. It can be any time from, there may be particular conditions which cause it to come on in the 30s, or it may be much later in life, 60s, 70 odd.
Can you describe the process that you put a potential patient through before you decide to put them onto testosterone replacement?
The process that we put a patient through is more like a clinical examination to look for signs of testosterone deficiency, but also there are certain questionnaires that can bring out the symptoms and paint the characteristic picture of the male menopause. It's known as the aging male syndrome questionnaire, and it has the questions about energy, drive, whether the person's depressed or not, whether they have dry skin, whether they have night sweats, and particularly questions about their erectile function.
And can you describe the effect when you put them onto testosterone?
Sorry, so
Can you describe the effect on the patient once you've decided you're going to treat them and you either inject or give them gel?
treating patients with testosterone is one of the most gratifying forms of clinical treatment, because it can take effect within a few days or certainly within a few weeks, and the symptoms just go away and stay away if you've got the right dose.
And how long does it last if you put, say, a patient onto injections for testosterone deficiency? How long will that injection last?
The length of action of an injection is quite variable. It's one of the tests for the degree of resistance, and it can be a standard injection can last either a month, or it can last 2 months, sometimes 3 months, if the person's quite sensitive to testosterone.
How risky is the treatment?
Fortunately, it's a very safe form of treatment. It's one of the safest forms of treatment there is, because it's with a natural hormone that the body's used to and can cope with. So you monitor it carefully, and there's very little risk to it. It used to be thought that it might cause prostate cancer, but that is a scare called hormonophobia, which is in the past. Nowadays it's regarded as safe for the prostate, safe for the heart, safe for the circulation, and safe for the brain as well. So really it's a very safe form of treatment, and that's why I'm recommending that people stay on it for the rest of their lives if necessary, but not more than 50 years.
How many men in the UK suffer from testosterone deficiency?
About 20% of men show testosterone deficiency, but I'm more and more adopting the thing that you don't have to have florid symptoms of testosterone deficiency to benefit from it, and that it's a good form of preventive medicine that women can share with their husbands in terms of hormone replacement therapy.
And how many women in the UK suffer from deficiency?
Well, generally it's reckoned that at various times in their lives, but mainly around the age of 50, 100% of women suffer from estrogen deficiency and could benefit from hormone replacement treatment with it.
How old is your oldest patient?
I have had patients who've gone up to just over 100, but generally they age happily and in good condition, more into their 80s and 90s.
And how old is your youngest patient?
My youngest patient is probably around the age of 25, but then you have to be careful treating with testosterone, because it can suppress the fertility below a certain age. So generally I pass the younger patients on to another doctor who specialises more in fertility treatments.
Is it possible with treatment to maintain a strong sex drive well into your 80s and 90s?
Certainly it's possible for men to maintain their sex drive into their 80s and 90s. It depends on the partner they're with, whether it keeps them interested, so to speak.
Can you explain the emotional feelings of people who come to you with erectile dysfunction?
Men with erectile dysfunction can really be quite desperate and quite severely depressed because they feel literally impotent, unable to cope with life, and that they can't satisfy their partner, and that they're really very unhappy. But it's possible to restore their vim and vigour and their esprit de corps.
Do they feel ashamed?
Yes, they can feel very ashamed when they're impotent. And it affects, not only their sex lives, but their business lives as well.
Do they feel confused?
They can feel very confused about what's happening to them and need their confidence restored quite considerably. And many people have become irritable and bad-tempered when their testosterones are low, and they may have given up their business, or their business may have given them up.
Do they feel angry?
Yes, they can feel very angry and irritable, which is not what you would expect of a low testosterone person, but certainly they can be very angry indeed.
Can teenagers suffer from it?
It's very rare that teenagers will suffer from testosterone deficiency, and they need to be investigated in far more detail in a different way. You can't just put them on testosterone. You may need drugs that actually stimulate the production of testosterone because you don't want to deprive them of their fertility for life.
Does lifestyle affect erectile dysfunction?
There's a lot of elements to lifestyle that can affect testosterone deficiency and erectile dysfunction. Certainly brewer's droop is not a mythical condition, it's a very real condition.
So alcohol?
That can come with too much alcohol. Sometimes people sort of burn themselves out prematurely, and their testosterone goes from high to being low. So if they're constantly tired and indulging in either excess alcohol or drugs, then it can decrease their testosterone levels.
Just explain for me the link between excessive alcohol drinking and erectile dysfunction.
Well, Shakespeare said that alcohol enhances desire but diminishes performance, and this is a very real factor, and it really does affect it's possible to pickle the testes, so to speak, and to reduce their ability to produce testosterone if it's really excessive and over a long period of time.
So the alcohol is lowering the testosterone?
The alcohol is damaging the testosterone and increasing resistance to its action, so that it makes the testosterone less effective.
Bad diet? What effect does that have?
So yeah.
Bad diet?
Yes, a bad diet is not so harmful in relation to testosterone. I think excessive vegetarianism can reduce the production of testosterone, and anything that, if the diet is bad enough to undermine the general health, then that can reduce testosterone as well.
And vegetarianism, excessive vegetarianism, there's a link from that to a lower production of testosterone.
Only in extreme cases of vegetarianism, which are seldom accompanied by excess alcohol, because it's part of a healthy living profile. But certainly it's been shown scientifically in studies that going on a vegetarian diet can lower your testosterone level by about 14%.
Obesity?
Yes, this is obesity is an increasing cause of testosterone deficiency, and it's possibly linked with a diabetic tendency. And so often people become obese, become diabetic, and then become testosterone deficient.
Why does obesity reduce testosterone?
Obesity affects the general metabolism to reduce testosterone in a quite marked way, and that's why testosterone deficiency is becoming more common, particularly in the overweight.
Are most diabetics prescribed with testosterone in this country?
No, it's very sad, but the important part that testosterone can play in diabetes is not recognised. And I really came into testosterone treatment because of a man who had severe arterial disease and was becoming obese, and part of the treatment was to actually get him to lose weight, and the testosterone dilated up the blood vessels and improved his circulation so that he didn't have to have amputation of legs. And I think it's very sad, the number of diabetics who lose their legs because of lack of testosterone and its effect on the circulation.
Do you advise your patients to use a combination of testosterone and Viagra?
Often I think the two work very well together. The drugs like Viagra work very well in conjunction with testosterone, and the results can be quite dramatic, and potency can be restored to very much the patient's satisfaction.
Why do they work so well together?
The reason for the combined action between testosterone and Viagra or drugs like it is because one of the things that it does is to restore the smooth muscle in the penis, and this is effective in causing the Viagra to work better.
Can the use of Viagra on its own be effective for people with testosterone deficiency?
Yes, sometimes Viagra on its own can work effectively, but usually it's only temporary. And the typical story of a Viagra user is a diabetic who is given routinely Viagra, but it only works for a short period of time because the underlying testosterone deficiency is working against it and it's becoming less effective.
Does testosterone improve the strength of erections?
Yes, certainly testosterone can improve the strength as well as the frequency of erections. It's one of the beneficial actions so that potency is restored. Often it's been found experimentally that testosterone deficiency can reduce the size and strength of the muscle in the penis.
Does testosterone improve the quality of orgasm?
Certainly, testosterone can help improve the duration and length of orgasm in a quite satisfying manner, as well as restoring general sexual function and pleasure.
And does it increase the amount of sperm ejaculated?
Usually, testosterone treatment can, over a period of years, reduce the amount of sperm, and certainly the number of sperm are reduced. So you'd think that wonderful fertility would be the result, but sometimes it's quite the result, and you have to warn patients that testosterone treatment over a period of time may decrease the sperm count.
And why is that?
There's a narrow band of hormone level necessary for sperm production, and if you exceed that limit, then the number of sperm decreases.
How much does the treatment cost?
Treatment is very variable. It does need to be supervised, so it's the medical supervision and the setting in which it's provided. The actual testosterone itself is really can be quite cheap. The injections are more pricey, but the skin gels can be very cheap indeed, cheap as vitamin pills.
How often do you need to have a blood test if you're on testosterone?
Yes, you need to have a blood test before you start on testosterone, not so much as to see what the level is, but just get a marker, and then when you put the patient on testosterone, you don't want him taking excessive amounts, so you need to regulate it by means of blood tests, but they're more from the safety side, and to make sure that the blood doesn't become too thick, for example. You can get an increase in hemoglobin if you give excessive amounts of testosterone, so it's necessary to monitor that by means of blood tests.
Why is the treatment so controversial?
I think the treatment's controversial and not recognised by the majority of the medical profession because they don't realise the safety of it. We've got what you call hormonophobia, which is an unreasonable fear of testosterone treatment because of rumours, about the safety of testosterone, whereas it's actually a very safe drug. Many people regard it as dangerous and think that the patient might actually become more aggressive, which isn't true at all. It actually makes them much calmer, more satisfied with life, and it generally makes life easier. So a lot of my last 25 years have been spent writing books and articles about the safety of testosterone treatment, and indeed the need for testosterone treatment, which is only given in about 5% of cases where it's needed.
What's driven you to champion the cause in this way?
Well, it's such a satisfying form of treatment to give. The results are so good, and you see you can change lives, you can restore a man's happiness and libido and potency, and it's such an effective means of treatment, and it's one that's so neglected. It's just ignored, and so I've been working away and writing books and articles to point out the need for testosterone treatment.
And what's the reaction of the medical establishment been?
Well, by and large, they've thrown up their hands in horrors, though now it's becoming more recognised. But still, you know, when there's hard pressure on the medical profession, they don't want new conditions to diagnose, and they don't want to spend any money on it, which is a pity, because actually it's an effective form of preventive medicine, and in the long term it could actually save a lot of money in terms of the damaging consequences of its lack in relation to depression, in relation to broken marriages, in relation to people retiring early because of the lack of incentive provided by testosterone.
Do you think the NHS will ever be converted?
Yes, I believe they will, as the evidence piles up that testosterone treatment is necessary and effective, and people see the results. I mean, it's not just a form of treatment that is a luxury, but it's a necessity for men, and that's why I've written this book, a 50-plus plan to his and hers HRT, to convince the medical profession in general that testosterone treatment is both necessary and desirable and cost-effective and need not be expensive. It's not a luxury treatment, it's a necessity.
In your email to me over the last few days, you made a comment about the disastrous fall in the uptake in America. Am I right in thinking that?
Not in testosterone. It's the fall in HRT followed the publication of the 2002 Women's Health Initiative report, which was a bad study using a bad preparation, badly publicised, and it caused uptake of HRT for women to drop from 44% down to about 5%, which is a public health disaster, and we're still trying to reverse that.
So it's a hormone replacement for women that's fallen off.
Yeah.
Am I right in thinking that testosterone treatment has actually been very popular in America of late?
Testosterone treatment has been on the increase, if anything, in America, and has risen to about 10% from about 1%. But that's because in America you tend to get what you pay your doctor to give you. So that's on the increase, and it's getting more popular. And I hope that this new book, the 50 Plus Plan, will encourage men to use it and take it up and stay happy and healthy. It's like watering a plant, you know. You don't want to just water a plant when it's gone limp and wilted. You want to keep a little gentle watering going, and it maintains the health of the plant, just as testosterone treatment can maintain the health of men, and estrogen treatment can maintain the health of women.
Dr. Carruthers, many thanks.